folks. You're listening to the Jobs Podcast. I am your host, Tim Hendricks. Your time is valuable. I'm not going to waste it. Let's get right to the interview. Hey, folks. Thanks for joining me on the Jobs Podcast. This is your host, Tim Hendricks. Today, we have a physical therapist with us. He has made an entire career, 20 plus years, in helping others with their physical therapy. And now he specializes in hands as well as a few other things. Bruce, thanks for joining me today.
Yes, Tim, thanks for having me. I've enjoyed your podcast and I appreciate you asking me to be on.
Oh, you bet. So let's start with the origins of Bruce. Tell us a little synopsis of your childhood story and walk us through your early education.
Yeah, so I was born actually in Omaha, Nebraska, and then when I was 2, my parents moved back to central Nebraska where they were both from. My dad was in education and he took a job to be a high school guidance counselor at a small school there close to where my mom's parents lived, where they farmed. So my parents farmed alongside my grandparents and helped them. And then dad was a high school guidance counselor. So I have a twin brother and then a brother who's 5 years younger. So it was a great childhood growing up on a farm, getting a good work ethic, working outside, getting your hands dirty, and just enjoyed sports and the opportunities that a small school, small community provides where we could participate in a lot of different things. And so just really my dad being a guidance counselor, when it was time for us to look at colleges, we had the benefit of having him just really encourage us to look into what we wanted to do. So doing job shadowing and just making sure when we went to college, we kind of had some direction where we were going. So I had an uncle who was a physical therapist. And so we job shadowed at his clinic some. And so I kind of had an idea I wanted to go into either physical or occupational therapy and went off to UNL. And so just kind of had good direction that way.
What was it when you job shadowed your uncle? What was it about physical therapy or occupational therapy that just kind of tripped your trigger, so to speak?
You know, I knew I didn't want to sit behind a desk all day long. And
Yeah.
I just like the variety where you were seeing different patients. You're talking to people all day long. I did have an interest in science and just human anatomy with sports, having just minor injuries and kind of recovering from that. And so to kind of pursue physical therapy or occupational therapy, it really just kind of fit well for that.
Okay. When you're dealing with people that are physical, you're a physical therapist, you're dealing with folks that come in. Am I correct in that everybody starts off as a general physical therapist and then they kind of develop their specialty or the area of expertise that, like yours with hands, other people maybe knees or back? Or how does that typically kind of pan out?
Yeah. So, and I should clarify, I am an occupational therapist. So I
Okay.
did choose to go OT.
Okay.
But you're right. When you get done with school, you're a general therapist. And for occupational therapy, I kind of had a bent that I wanted to go into hands. For occupational therapy, when you get done with school, you can work in a hospital setting and pediatrics. You can go into mental health. You can do a lot of different things. But with the hand aspect, I was fascinated with the hand, the anatomy, and observing, you'd see how much progress those patients made. Sometimes how traumatic their injury was, if they had an amputation or they had cut a tendon or it's just really debilitating. And you'd see them get back to their normal activity, which was really gratifying. So that's kind of what drew me to that. Where I work now, we see people from all walks of life. And so you really see how a major injury can have a huge impact on their life, their quality of life, financially, spiritually, family. It just really can affect them. So you feel like you get to play a role in helping them recover.
I jumped ahead a little bit. You were talking about your education. You went to You said, is it University of Lincoln? Is that what it was?
Correct. I went to
Okay.
UNL, and so for whether you're going into PT or OT, at the time you would just work on your prerequisites. So you're working towards 20 years ago, you could get into school after 2 or 3 years. You'd have the prerequisites done, and you could get into professional school. In Nebraska, it was either UNMC or Creighton. There's some other schools now as well, but now you kind of have to go and get an undergraduate degree. It's probably less likely you're going to get in after 3 years, but then it's another 3 to 4 years for your professional school. So I went to Creighton, and that was another 3 years. And then 2 years of that is going to be didactic work. And then we did two 16-week rotations. They call them field works, kind of like a residency where you go and you work somewhere, but you're learning under a therapist. And so now that's changed. I got out with a bachelor's degree, and they've slowly changed that. My class was the last class to get a bachelor's degree. Now it's a clinical doctorate at Creighton, and most of the schools are going to that. I think by 2027, everybody has to be at a clinical doctorate level, but it's another year of school. But there are still some master's programs out there too.
What is the general push behind the extension in the schooling? Is it just because there's so much more knowledge about anatomy and physiology, or a a technology thing, or is it just all of the above, or specializations? Kind of.
Probably all the above. I
Okay.
do think the training's better.
Okay.
There's probably a bigger push for research, evidence based, which is good. But then now being in private practice, people are running up a lot of debt. And so
Yeah.
the cost of schooling does go up. Reimbursements going down from insurance companies and from Medicare. So does get to be a little bit of a rub that way. Um, but that's kind of the world we live in. Yeah.
Yeah. Do most folks that get into your line of work, is there a I mean, I'm not asking you for exact percentages, but do you find that most folks that are physical or occupational therapists work for a private company, or do most of them work in a hospital setting? Do they start in a hospital setting and then usually transition to private, or how does that typically play out?
A lot do start out in a hospital setting.
Okay.
And right now, there's kind of a lot of competition to find the right therapist. So therapists are coming out at a good time where they've got job options. There's probably more opportunities right away in, say, a nursing home setting or a hospital setting. Their reimbursement is a little bit different than outpatient orthopedics, so
Hmm.
they can pay more. Some of the nonprofits too will have the ability to do some loan forgiveness, but you might have to sign on with them for 10 years or 5 years to get some forgiveness on some loans. So for some people, that can be a great option. And then in the rural setting, kind of the same way. There's probably maybe a little bit better pay, and then some of the loan forgiveness as well.
I recently talked with a nurse, and they have options for traveling nurses or folks that will be based in a major city, and then maybe they won't travel to an extended place for 3, 6, 9 months, whatever. But 1 or 2 days a week, they will go to a certain rural hospital or nursing home or whatever and do that. Is that something that is becoming more common, or how does that play into your career path, if at all?
It is, and people have opportunities to do that. You could travel and you could move around and do a 3 to 6 month stint. Different. There's also opportunities that you could moonlight and do weekends at a
Hmm.
hospital setting or in a nursing home setting, or even I know some therapists will do home health on the side if they wanted to, or they kind of do a combination of part time work in several different places doing that. Mm-hmm.
Is the specialization aspect of your career, when you're new, am I correct in the assumption that You're going to start probably in a hospital. You're going to be expected to know how to do pretty much any kind of physical therapy and maybe not dive as deep. But then when you get into a more specialized aspect, a department of the hospital, or you work for a private company, that's where the specialization tends to kind of show up.
Exactly.
Okay.
In my case, jobs were hard to find 20 some years ago. So I was working part time or even on call for different hospitals and doing weekend work and getting some loans paid back. And so you just kind of did what you could. But then you tried to work your way. I knew I wanted to do hands and do the outpatient setting. And so got a job doing that as well. And then you're doing your continuing education because you've got to maintain your license. You've got to do a certain number of hours every year. And so I would just really try to work towards that or trying to get your foot in the door somewhere and work towards that specialization. So for hands, in both physical and occupational therapy, you can sit for an exam to be a certified hand therapist. And at the time, you had to have 5 years experience and then a
Hmm.
certain number of hours working directly in the upper extremity. Now they've changed that so it's 3 years and you can sit for that exam. So we have students that kind of wanted to go into hands. And so we just tell them to get on the fast track to do that, where you study outside of work, you're doing your continuing ed, and you just work towards that specialization so you can sit for that exam. And then that just gives you more credibility with the doctors. You see in medicine, physicians are more specialized. There's still some general orthopedic surgeons, but a lot of people are checking who's your shoulder guy, who's the knee guy, who's the hip
Hmm.
guy, who does the best with that. You really see that the public has a high demand on high quality healthcare. They have a high deductible, they're paying high premiums, they want the best care, and we place a high value on good health. And so I think the same then trickles down for therapy as well. Patients want to see who's your best therapist for shoulders, who's your best therapist for knee or ankle. And so, uh, being in private practice, we try to do that and encourage therapists to go down a path that kind of suits their passion and specialize that way because you're going to be doing your continuing education anyway and maybe try to work towards a specialization and you just build those relationships with your referral sources and your patients. And then you start to get older and you're seeing the same patients back for their second or third injury, and you've kind of built that rapport with them.
I think folks are kind of expecting what you highlighted a second ago. The guy that's a plumber that hurts his shoulder wants to get the same kind of care and treatment that a professional football player that's got a 15 million contract is getting. And I know that I'm not as valuable to you as the football player, but I'm more valuable to my family because I'm the one that keeps a roof over our head. So you got to give me the same, duct tape isn't going to work anymore in 2025. So your your specialization, do you how specific does P and OT get as far as you said there's a specialization in hands and you can take a test for that? Do you typically have a generic breakdown of people that just do the neck or the back or the hips, or like how fine tuned does that specialization get?
It varies a little bit. You can get a general orthopedic specialization as a physical therapist. You're considered an OCS, and so you'll see those letters behind their name, and that goes a long ways with the physicians. We're in an outpatient orthopedic setting, and so we try to have our therapists work towards that. You can also go as far as the spine. We have a therapist who has specialized in manual therapy, and he's done a fellowship with that, and so he is really, really good with the the back and neck, and treats some patients maybe just a little bit different than what a general entry level PT would as well. So
Hmm.
you can kind of do that, and I'm not familiar with all of them, but you can certainly work towards specialization in whatever area you'd like to.
To jump back to your education for just a second, you said that you had to get your license. I'm assuming that at the end of you have your bachelor's degree, you've gone to your specialized schooling for about 3 years, you said, I think that was right.
Mhm.
Then you just have one, is it a state test or is it like a national test? Is it is it a practical aspect as well as a written test, or is it all written? Kind of tell me about that process.
Yeah, it's all written. So after
Okay.
you get your degree from whatever institution, then you sit for that exam. And then before you can apply for a license, um, to be licensed with that state, then you sit for that exam and you pass that, you get your license, and then you have to go through, your employer puts you through a credentialing process with all the insurance companies so that you can bill for your services as a licensed therapist. Mm-hmm.
Is that a state license? So if you wanted to go work in, a neighboring state, you would have to apply. Is there a reciprocity kind of nationally, or how does that play out?
You have to do it in each state.
Oh, okay. All right.
And so when I first started out, I was living in Omaha. So I had a Nebraska and an Iowa license, and I could practice in both states.
Okay.
Yep.
What, how many questions are on that test? People always want to know the answer to that.
I forget, Tim, that was a long time ago, but I want to say it was either a 3 or 4 hour test. So,
Ooh,
and I'm going to take the whole time because I'm not the smartest guy, but it's a big test. There's a lot of pressure on it.
yeah.
The schools, really do prepare you for that, and by the time you've practiced for a while doing your field works, you're well prepared. It is a lot when you're covering pediatrics to orthopedics to neurological conditions. It is a big test that you got to study pretty hard for. Yeah.
Hmm. What changes have you seen in your career? How many years have you been doing this now since you graduated?
So it's been 24 years now, and it has changed a lot. I would say like the documentation is a lot more. Before you were writing in someone's chart, their physical chart. Now with technology, everything's on the computer. So you're documenting in that person's chart on your computer, you're charging or you're billing through that, you're scheduling through that. And so it does make it easier. However, with some of the regulations and with Medicare, there's just more that you have to put in there, which does make us better. And
Mhm.
it's well documented. It's easier to, if you get denied an insurance, and you really try to document so you can justify what you're doing and stand up to those insurance companies a little bit for the patient if it's needed and warranted. Nobody likes change, but it's always changing, so you might as well embrace it. But with AI coming,
Mhm.
it'll be interesting how that changes some of the documentation as well.
Have you seen a big change in the techniques that you use? Let's focus in on the hands. I would imagine that a lot of the stuff, it because hands, we've been around for ages. So, what's changed as far as your therapy to are there devices that you use now that 20 years ago you didn't use, or was there a big change to where we used to do this all the time and now we realize that we need to do the exact opposite as far as movement or rehab or conditioning?
For sure, that's a good question, Tim. And it's interesting when you go to um, some of your continuing ed courses or some of the bigger courses across the country. It is always changing, and it's good to stay abreast of those things. You look back what I used to do as a therapist 24 years ago, and I kind of cringe where I probably wasn't doing the patient as much good. But I guess with hands, what I'll start with is we make a lot of splints for people. You can get an over the counter brace to immobilize either a joint or a wrist, but we kind of pride ourselves in fabricating out of an orthopedic or an orthoplast plastic material that we heat up and we can mold to the hand. And so we can change the angles in each of the knuckles. of the fingers based on what the surgeon wants or based on what the protocol calls for fractures, for tendon injuries. We can modify that so they can do a certain amount of movement in that, which helps the movement. So, from that standpoint, we move people a lot quicker after surgery than what we used to. And you really see if someone's been immobilized for too long, particularly in the hand with having that many joints in a small area, they get really, really stiff. Or if
Hmm.
they've had a crush injury or an amputation or a tendon injury, the amount of scar tissue that forms in the hand can be a lot. And it raises havoc where you just cannot get those tendons gliding through there or moving, and so they get scarred down. So the surgeons entrust us a lot to get them moving, and so that's one aspect that has changed a lot. And then some of the
Hmm.
different machines, or we'd say modalities, we still do heat and ice, but we have there's a shockwave machine now where you do acoustic sound waves through that soft tissue to promote healing. We use some different tools where we kind of mechanically rough up that tendon and cause a bit of an acute injury in a controlled way to stimulate some of that tissue to heal. Where if there's an area with a lack of blood flow, your body starts to sort of ignore that and it gets to be chronic. And so we cause a little bit of an acute injury to stimulate your body to heal that. And then while that's healing, we're moving that joint or that body part so it heals in a functional state.
One, am I correct in that the shock wave, the ultrasound you just mentioned, and then the acute injury type thing? I don't want to grossly oversimplify it, but you're trying to increase the blood flow to that area that will increase the healing. Is that the general premise behind that? Okay.
Mm-hmm.
Do you run into, well, let me back up. What is or is there a common type of injury that you're seeing when you're dealing with people's hands? And I'm specifically thinking about, is ergonomics still a major issue? I remember in the 90s, I had a supervisor that was just mad about ergonomics, chairs and, wrist pads and mouse pads and all that kind of stuff was just all the rage. It's so common nowadays. Do you still see a lot of ergonomic type things?
We do, and
Repetitive injury, I guess, would be a better.
correct. And so, in a way, you could specialize in that if you wanted to. But I think whatever injury any repetitive injury you're having, if there's a nerve issue, there's a compression from repetitive trauma in a job, it's important we're working with that body part, but we're not just focusing on that body part. And that's why conversing with the patient and talking to them, you can really get to understand what is causing this. Because if we can do all the right exercises and the right treatment techniques, but if they're going back to the same repetitive trauma in their job or at home, then it's not going to get better, or we're only going to get them to a certain point. And or if they're sitting in their chair wrong, and it's not just focusing, let's say, on the wrist, but you're looking at their posture. How are they sitting? How are they holding their, just everything that has to do with ergonomics? If you look at that and then looking up into their shoulders, you can have a bigger impact for them for sure.
What you just said right there about their posture, I immediately gravitated towards electronic devices, smartphones, tablets, and the rolled forward shoulders and the head down. Is that at the root cause of a lot of ergonomic issues?
It is a large part of it. And that might be part of our conversation where if we're evaluating a patient and you're talking about what their symptoms are, what do they think's causing it? And then we'll have our spiel about that of,
Mhm.
you know, don't do that, try not to do that, or here's some alternative ways to hold that, or even in sleeping postures, you're spending 8 hours at night in a certain position, try a few different things this way. And then also when you're on your phone or on your laptop, trying to make some changes there as well. Mm-hmm.
I may put you on the spot on this question, and I don't mean to, but it just popped into my head. Is there any, if you could give just the general population, anybody listening, one or two improvements that you see just walking around Walmart or walking around town or wherever you go, everybody that you look at, because I know you, your posture is impeccable. It's really, really good.
I don't know about that.
Well, you stand up straight, and all the things that our moms used to tell us to do. But is there anything that you would tell folks, like if you would just change one or two things, your neck wouldn't hurt or your back wouldn't hurt? Or, I mean, I know I'm not asking you to treat the general public over a podcast, but just
Right.
friendly advice from someone who's informed.
Well, I mean, we're all of our bodies are God made us all different, and
Hmm.
so our body types are different. But I do think, and I'm biased as a therapist, but if we just moved more, that so many jobs are sedentary, and you're overworking certain muscles and you're not working other muscles, and so
Okay.
figure out a way to have a routine where you're staying active, you're stretching to some degree, but you're not maybe joining a CrossFit class. Nothing against CrossFit, but
Yeah.
you kind of do what's appropriate for your body type and your age
Hmm.
and just stay. And it just sets you up for success when you are sedentary, but then you can enjoy your life as well and set you up for success for the long term for sure.
Walking seems to be something that if you kind of halfway pay attention, it's just all of the influencers and everybody online, the fitness gurus, are like, just walk. If you would just simply walk more. And I think that's one thing in our country that we don't do enough of compared to the rest of the world is we're such a large country. We drive 30, 40 minutes. I can't walk 10 miles every morning to work. Well, I mean, I guess I could, but I'm not going to get up at 2:30. So,
Right, right.
so,
But it is a beneficial activity. And even if you have back pain, even if you have, you just modify what you're doing. Some people swim, some people,
mm.
have to switch from running to walking and then to riding a bike and but to stay active in some way is definitely beneficial.
Let's jump back to the education that you got for a minute and talk about, are there certain schools in the country that specialize or that are really like, the pinnacle of occupational or physical therapy? Or is there a kind of an industry standard in your line of work that every state is going to have multiple schools, most likely, that can specialize in this?
Yeah. It's kind of an industry standard a little bit, and the profession kind of has their criteria that each school needs to meet. And there's going to
Okay.
be, each school is going to maybe pride themselves on one thing or another. But, up to this point, it's been kind of the doctorate program where they sell that. But I tell people or students who are looking to go into therapy, it's you make your education what you can of it. And you need to get into school, you need to get through, but when we're hiring or when I'm hiring a therapist, it's more about the person. Is it somebody I want to work with or I want to be in the room with all day long?
Hmm.
And so it's more of a personal fit. Do they have the work ethic? We can teach people some of the clinical things. They've got a good background from school, but it's somebody with a work ethic who's humble, who wants to work hard and serve people. And it's not all about them, but it's about the patient. That's who you kind of want on your team versus somebody pounding their chest that they went to such and such school.
Okay. So the documentation behind the person, while important, is not the end all be all to success.
Correct.
If somebody, and you kind of explained some of the things just there, but let's elaborate on that just a little bit. If someone, let's say there's a kid down the street from you that is about to graduate high school and he wants to follow in your footsteps, and he knocks on your door and he says, "Mr. Bruce, I want to do what you do. Can you give me some advice?" And you've got just a couple minutes to give him some high points. What would you, looking back on your career and the changes and what you know of the industry now, what would you advise him or her to do?
Yeah. And I think back and I could think of people that I wanted to emulate myself by, and it's the easy thing to do is look at them and say, "Well, gosh, right place, right time.
Yeah.
I want to be there." But I think just encouraging people. There's a lot of information out there where there's a lot of talented people who maybe aren't going into med school, so they go the therapy route. So they're really talented. It's easy to say, well, there's increased competition for these positions in the school. I just tell people, and I remember, my dad telling me and other people, just you go for it and you work hard at it and you're gonna succeed and probably have a backup plan, but at the same time, go for it. And you kind of you got to go into science and you got to do well in anatomy, physiology, those core classes, but setting yourself up for success in those classes and just really putting in the time, and then also doing some observation where you follow a therapist in probably different settings. Even if you feel like you know what area of therapy you want to go into, show that you're well rounded and you learn as much what you don't want to do in therapy as what you want to do. But you've just shown initiative. You've shown that you've done your homework and put in the time to set yourself up for success.
I can see that some folks may want to specialize too early. And I think, would you agree that, well, you may want to specialize in shoulders or knees, the knee bone's connected to the hip bone kind of thing, and having that general, I need to know kind of everything that's going to teach me before I worry about specializing. That comes after I know, I say everything, but I've absorbed the whole picture, and then I
Right.
dive into the specialty. Do you find a lot of kids come in and go, well, I want to be a back expert? Okay, well, the back is affected by the shoulders and by the hips and by the knees and the ankles and everything else.
Correct. And that's a good point, Tim, where being well rounded and good at everything. Some therapists come out and kind of the hot thing is I want to be a sports therapist.
Oh,
I want,
oh,
I want to treat, this is my wheelhouse. This is what I'm really good at. These are the types of
hmm,
patients I want to see all the time. And although that's good, in this day and age, there's a certain amount of Medicare that you're going to see. The older population, it's an active population, and you're going to get, let's say, 25% of your patients that you really want to see, that, or that's your diagnosis that you really enjoy seeing, and you have that specialty area, but you may not be able to fill your entire schedule with that type of patient. And
hmm.
so being able to see a wide variety of patients while you're building that caseload up, I think is important. And for that's kind of what we encourage our therapists to do is work towards a specialty, but just understand you're going to have to probably see some people that you don't get to cherry pick every patient you get to see too.
Yeah.
We're still going to treat the people that call in for an appointment and we give them really good care. And then we're still marketing to the doctors in our community. This is what we're really good. Each therapist, what they're really good at too.
You're not going to get every patient that comes in and allows you to be a rock star sports PT. You've got to pay the bills with the baby boomer that comes in with a bad knee or something like that. They all should get, and you give the same service.
Exactly. And the same type of care.
Yeah.
Exactly. And
Yeah.
I remember being that way where this is what I want to see, or these are the types of patients I want to see. But I don't know, you learn so much from, and we were talking before you started recording, but you learn so much from people, a lot like your podcast, Tim. You're talking to different people. You learn so much from them. And it's, as I've gotten older, it's not so much the diagnosis as it is just the people that you really enjoy talking to. Everybody from the blue collar worker to the CEO of his company to the
Hmm.
banker to, people of all walks of life you learn from, and the farmer, and kind of making those connections from my growing up, and just really enjoy that variety throughout the day. And I am fortunate you get to see that in the upper extremity with a variety of injuries.
It's got to be satisfying when you see a patient come in who if their hand is extremely damaged in whatever way and they can't even, hold a coffee cup or use a spoon or write. And then fast forward, I don't know, 6 months, however, whatever the time frame may be, they're able to do just those basic things that I'm sure we all take for granted. And you're able to watch them progress and all of a sudden they do it. That has to be, it's got to make you feel good to see that happen. And you're a part of that.
It does, and kind of the that camaraderie that you share with them as you walk through them with
Yeah.
that. And I think beyond that too, Tim, is like you think about a lot of people are living paycheck to paycheck. If you're out of work for
Yes.
you weren't doing anything wrong, you're involved in a motor vehicle accident,
Hmm.
somebody came across the line and you have this horrific injury, you're out of work for 3 to 4 months, or you're on light duty and the way work comp works, you're not going to get full pay for being on light duty.
Hmm.
Or even if it happened at work, you're not getting full pay while you're off work. So the financial strain, the family strain, you're walking with people 2 to 3 times a week for a half hour to an hour, and you get to know them pretty well and you're seeing their struggles. It is gratifying to kind of help them with that or feel like you play a part in helping them with that, but also the urgency that you feel like you need to help them because it's pretty easy to put yourself in their shoes as well.
Do you find that you have these benchmarks, and if the patient can get tangible evidence of improvement, like you can point to them and say, you came in here 2 weeks ago and look at what you've already accomplished? I would assume that it's easy to keep someone going when you can check these little boxes of progress, and so they can see that I'm not just going through the motions, I'm not wasting my time, this is actually making a difference and I'm progressing towards what I was pre-accident.
Exactly. And, we serve kind of a large area. So you might have people driving, half hour, 45 minutes to an hour. You want to
Hmm.
make sure they get really good care.
Yeah.
And it's an encouragement to them, hopefully, because they can get down and day to day, they don't see a lot of progress. But just like you pointed out, every couple of weeks, you're showing that to them. They might be worried that they're not going to be able to keep coming, but you kind of show them that there is medical necessity that we can, and we're just doing what the doctor is requesting us to do. And show pointing out those improvements is an encouragement to them. And then they see how they're meeting those goals.
Yeah, the progress has got to feed on itself and it just makes it easier for them to keep going.
For sure. For sure.
Have you ever had, and I know that you're restricted on how much patient information you can divulge, so I'll keep it very generic. Have you ever had any cases where a type of injury came in and it was really severe in whatever way, and then you were with them and you just even doubted, I don't even know if I can help this person. And then looking back now, it took 8 months or it took 6 months, but they went from no function to they're back to almost normal, or any kind of earth shattering type cases that if you look back at your career are the first ones that pop into your mental Rolodex.
Yeah. I really enjoy the hand trauma. And it's sad to say, we're there to people's misfortune plays a big part in that. But
Yeah.
if someone, I can remember one guy cut his thumb completely off
Mm.
and they were able to reattach it. And a cabinet maker, and that's his livelihood. And for everybody, their hands are how they make their living. And in a lot of occupations, they're putting their hands in harm's way
Yeah.
and gets them in trouble. But some of those really horrific injuries where the gentleman with the thumb replantation, or they almost lose their arm, almost amputate it, they're able to save it. They're hospitalized for a long time, and they just think, are they going to be able to get back to their occupation? It is super gratifying, and you might walk with them or treat them for a year or 6 months. Those are the fun ones. Or I can think of some gunshot wounds where you lacerate a nerve, so you're losing all function, and the surgeons are really, really good, and they can repair that, and that nerve regenerates over time. it's really cool to see the progress that they're able to make.
Yeah. I'm going to ask you a question that I just thought of, and I think every PT and OT that listens to this is probably going to cheer when I ask this question. But what do patients get wrong when they're looking at their part of this physical therapy process? What can they do at home? Because I think about some injuries I've had, and I leave and they give me a piece of paper with all these exercises that I'm supposed to do. And I may do them a couple of times and then I lose the piece of paper or I can't find the band that they gave me. And I don't do what I'm supposed to do as the patient. What can patients do when they leave for the day and you're not going to see them for a few days or a week? Where do patients go wrong in their responsibility for their healing?
Sure. And that's a good question, Tim. And I mean, we're all pain's a good motivator. So when you're in
Yeah.
pain, you're going to do stuff, right? And
Hmm.
then when you start to feel better, we get away from that. And I'm the same way. We start out in January doing certain things, and by July you're on a different routine. But
Yeah.
I think, but I would say a lot of it's on the therapist too, where you got to get that patient to buy in, and you're not going to get everybody to buy in. But if you're giving really, really good care, and you're really educating the patient on what they can do and why they're doing it, then
Hmm.
it is on the patient. I think a lot of it, sometimes us as therapists maybe fall short in explaining the big picture as to why they need to keep doing this. But then we have people come back, 6 months later, and hey, I forgot my exercises. I just need a refresher on that, and that's okay too. And
Sure.
some things may have changed, but you're right. It is important that they continue to follow through with that, and then stay active, and hopefully follow some of that advice.
What is it that you like most about your job? And there may be multiple things, but what are the top one or two that they get you up every morning and they're your motivation to go to work, aside from a paycheck, of course?
Sure, sure. And that's a good point because the paycheck does wear off, and inevitably it does get to be work. But what I really enjoy is the camaraderie that we have at our clinic. There's something about an outpatient orthopedic clinic where the patients are coming because they're not in the hospital where they have to do therapy. They're coming because they want to get better.
Hmm.
And we have a really good team of therapists. And I get to be kind of on the ownership side of that with you know, um, other partners who are just really, really good people, same vision. We want to serve our community, but also serve our employees. That is cool to see other people succeed and grow in our staff and our therapists, and then in our patients. And you're just talking to people all day long, and you're learning from them, and you just want it to be a positive environment. And so I hope it is for other people. For me, it is. And that really makes work fun for me.
Is there anything about your job that you dislike? Is it the paperwork side of things or, you know,
Yeah. I mean, no one really chooses physical therapy, occupational therapy to do paperwork, but it
right?
is a part of it. Depending on the setting you're in, sometimes the hours, it's not always a 9 to 5 job. We work 4 10-hour days, which I really enjoy.
Yeah.
But we don't do weekends, or at least very often. You might have to go in and see somebody, but in a hospital setting, you're rotating on weekends, and I wouldn't like that. And that's kind of what gravitated me towards outpatient a little bit. But there are times with a 10-hour day, it's late, and I don't want to miss my kids' activities. And
Yeah.
now being there for that long, and we've hired people where we can kind of share in that and make sure everybody can get away to enjoy their family as well and help each other with that. But um, the paperwork, and then there's times where just those long days where you feel like you're rushed to get to other events as well.
Is there a certain type that you see is common in any type of therapy, physical or occupational? Is it mostly extroverted people, mostly introverted people? Is there a common skill set, like the ability to communicate, things like that? Some people can fake that pretty well. They may be an introvert who, when they get to work, they can flick a switch and become an extrovert. But do you find that most everybody around you in your career shares any kind of a personality trait like that?
I think, yeah, most people want to really help people, and
Mhm.
they enjoy being around people. You see introverts and extroverts, but just that quality of wanting to help people, and just kind of being enamored with the human body and understanding it, and then that passion to explain that and teach your patients, what's good for them or how to fix things, being a problem solver. Those are some common traits I would say that are important or common that you see for sure.
The one thing that a lot of people want to know when I interview about a career is the pay structure. And I'm always inclined to mention that, well, of course, it depends on where you live because the cost of living will impact. You can't take what somebody in New York City as a physical therapist is going to make and translate that to where you're at in Nebraska. There's going to be a pretty big difference, I would assume.
Correct.
So,
Correct.
if somebody is thinking about getting into this and they're thinking, well, what can I earn as far as when I get out of college and I've got my license and I'm now starting, is there a general ballpark that maybe, even if it's only specific to Nebraska, just give us a ballpark idea of what pay and then how that may progress as you've been in it longer and get more specialized certificates and whatnot?
And a lot of it too, Tim, like you said, across the country, it's going to vary. It's also going to vary in the type of setting that you work. So, in a hospital setting or a skilled nursing facility, their rate of reimbursement is a lot higher. So, some of those jobs, you're not comparing apples to apples. And
Okay.
so, some of those settings, they're getting a higher rate of reimbursement. They're able to pay a fair amount more. But you Google that and it's going to be a huge range, but you can expect to come out and probably make around 70,000 as a starting therapist and then go up from there.
Okay.
I will, any student who's looking at that and they say, where can you top out at? And that varies a lot, but the starting can be really high at certain places, and
Hmm.
they'll have an hourly rate, but you may not be guaranteed 40 hours a week too. And so you're making a high rate per hour, but you may not get 40 hours per week. Other settings are going to be you're salaried, and it can vary quite a bit. But it school debt is a big deal, but it is worth it, I think, for sure.
Yeah. Well, I can see the longevity of a career in your line of work. It's always going to be there. It's always going to be a need. And especially with the aging populations of the boomers, and then I hate to say it being Gen X, but we're not spring chickens anymore. So in the next 15 years or so, we're going to be where the baby boomers are, starting to end up. So what I guess you do have some job security in that standpoint is that human beings are always going to age and we're always going to need to help them in some form or another. And as long as we're doing work, people are going to unfortunately get hurt. And so there is, if you can get your foot in the door, and I don't know if it's physically difficult to do your line of work, but I would think you might be able to do that for a long period of time. You see what I'm saying?
Exactly. And you're right. And I'm biased, but it's a great career and for the long haul. I
Yeah.
will say I worked at Children's Hospital part time when I started out, and there was a therapist.
Hmm.
That is a physical job where you're on the floor with the kids, you're crawling around.
Yeah.
There were some therapists where they had had an injury and they had to go into a different line of therapy because physically they couldn't do that. In a
Oh.
hospital setting, you're helping with transfers. You got to be careful that you don't get hurt or hurt your back. But just ergonomics, like you talked about in our setting, you got to take care of yourself as well because it still is a physical job.
Mhm.
Standing over people that you're stretching them out. There's a fair amount of that, and so
Yeah.
we kind of have to practice what we preach. But uh, but there's always going to be a job for sure. And then there's people that go into management in a hospital setting and they're maybe not doing some patient care. You're always going to be able to find something. Um, there's been therapists that leave the profession and they go do something else as well. But with that education, your training, your experience, I don't think you're going to have a hard time finding a job.
Whenever you get a PT or an OT that is a patient of yours, are they the worst kind of patients you could get? You always hear doctors are the worst patients, nurses are the worst patients.
Not necessarily, but I know what
Mm,
you mean.
yeah,
There are times they're maybe pushing the limits on the protocol or what you'd advise them to do.
yeah,
And so it is humbling and hard to probably be the patient for sure. Yeah.
yeah. What's your best advice if someone that works for you, because not only are you in this line of work, but you are one of the owners of your company, is that correct? Correct.
Right.
Okay. If you have an employee that makes a mistake, I've said it on every podcast that I've done. We're all human. We all have and will make mistakes. It's just part of living on this rock. How you deal with it, how you respond to it is usually pretty key. What's your advice when an employee makes a mistake and you sit down and chat with them about it?
Yeah. That's one of my favorite questions you're asking your guest, Tim. And everybody deals with it different, but I think, um, we all learn more from messing up than we do with our successes. And so,
Mm.
you know, the biggest thing I think is that you just sort of embrace that and you see it and you make those changes when working with a student or an employee, or I hope if I'm keep making the same mistake, I want them to point that out that I correct it so it's not making their life worse. If it's our billing staff, anybody, but just to make those changes and then listening to that constructive criticism and learn from it. I think when I look back, like all of us have insecurities and just seeing that and kind of embrace that, and you kind of have to flex up on those things and just make those changes, knowing that you're bettering yourself and you're growing in your profession by learning from those mistakes.
The mistakes tend to make a permanent core memory just because they're unpleasant. The nice things are there, and it's always good to experience nice. But when you royally screw up, I don't think you're capable of forgetting it. And sometimes that's the best way to learn, unfortunately.
Correct. And I think in therapy, you work a long time to build your reputation amongst the doctors. And so you take it really serious. You don't want to mess up really big on
Yeah.
certain things. And, the gals that do our billing, they might roll their eyes when I made the same mistake on some different paperwork issues. But
Mm.
when you're treating the patient, you take it at another level where I got to be on my game so I don't do too much or I tell that person to do too much and then I jeopardize their rehab. And so those things you really are really careful with that you don't
Yeah.
mess up. And um, over the course of that treatment, you're gonna make sure you do your homework and you don't mess those things up. Or if there's something little, you're gonna correct it, and you're always listening to the patient. That if we overdid it, then we're gonna change it real quick.
If you look back on your life, is there a career that if you didn't get into the line of work that you're in now, is there something that you looked back and you said, I kind of that was always your plan B, or if you were able to go back and shift gears, something else that you would like to have done?
I've thought about that, and I didn't have a real good backup plan, Tim. I kind of put all my eggs in this basket, but I did at one time I'd maybe go be a teacher and maybe coach, and I think I would have enjoyed that as well. But now having kids, I'm not sure I had the patience for it. But
Oh yeah.
or my kids tell me I don't have the patience for it.
You're right. Would you want to teach physical therapy? And do you see a lot of folks that after they've done PT in the occupational or in the clinic setting, do they go then and teach?
There are a lot who do, or they might be kind of a guest speaker or do different things like that, or teach one class or teach a lab
Hmm.
on the side. And so there's therapists that do that as well. I enjoy taking a student who might do a 12 or 16 week rotation, and then you're kind of practicing right alongside them and you kind of mentor them. That's kind of where I see myself right now, and that I've enjoyed that.
Well, when you have a student come in and you're mentoring the student and they're doing their rotation with you, what are the ones that kind of make you smile as far as this one's got it? They have what it takes. I mean, are there some intangibles that you see in a new person when they come in that it just makes you think this is what I wish all of the students that came in were like this?
For sure. I think um, the humbleness and then just the willingness to learn. They're eager to learn, and they're not afraid to jump in and kind of get their hands dirty or get their hands on a patient and try things. But just the biggest thing I think is the servant attitude, where they just want to serve not only the patient but just the employees. How can I help? What do you want me to do to help with this patient, or learning those exercises? But then that they take it upon themselves to really learn the skills that they don't have yet as a new therapist, and kind of work on that so that they're competent to put their hands on the patient. And uh, just that oh, the drive to just do that themselves and be a self-starter, I think is kind of what really makes you smile or think that's the person I want to work with.
I do find a lot of folks when I interview them, they do tend to either say it directly or insinuate you can't be a sponge to soak up all this stuff unless you check your ego at the door when you walk in here. The ego gets in the way of learning, it prevents you from doing things, getting, like you said, getting your hands in there and actually doing things physically with the patient because your ego says, well, I'm not going to do that, or for whatever reason, it stops you. So check that ego at the door and come in, and I think you're going to be more successful in the long run. Would you agree with that?
For sure, for sure. And just that servant attitude,
Yeah.
or people that, they do a strengths finder, and they're a type A or they're a leader, but the servant leaders are the ones that really attract people or get people to follow. And so just that humbleness is a big thing for sure.
Bruce, I really enjoyed our chat today. How can folks, if they're needing physical therapy, or how can they find you or your company? Do you have a website, I assume?
We do, Tim. Yeah, I appreciate that. So we're Lincoln Orthopedic Physical Therapy in Lincoln, Nebraska, and it's just LOPT.com. And then all of our therapists are listed there. They can find my contact information there as well.
How many locations do you have in Lincoln or around Lincoln?
So we have 11 locations in Lincoln and around the area. Mm-hmm.
Okay, cool. Thanks, Bruce. I really appreciate your time today. You shared a lot of very helpful information.
Well, Tim, thank you. I really enjoy your podcast and I appreciate you having me. And you're always well prepared and have great questions.
Oh, thanks. Appreciate it. Have a good day, buddy.
Thank you. You too, Tim.
And that wraps up another episode of the Jobs Podcast. Thank you so much for joining me today. Hopefully you found that interesting. As always, I wait until the end of an interview to ask you to like, subscribe, and share. I feel it's important that I earn that support from you. Thanks again, and we will see you on the next one.